placebo effect has been known about in medical circles for a very long time, but exactly how and why it works has been elusive. But it appears we now may be getting some answers, and it isn't quite how many people thought it might work. At the basic level, the placebo effect is where a patient is given something which resembles a medication but actually has no medicinal value at all. Common examples of this are sugar pills and saline injections. Patients in trials of medications are tested against those who are given placebos, because even though placebo has no known medical benefit, the patients respond positively compared to those given no medical treatment at all. However, the placebo effect is more than just better than no treatment. Different types of placebo treatment are actually also better than others. Placebos given by people who look like doctors, so with white coats and stethoscopes, are better than those given by ordinary looking people. 2 placebos given twice a day work better than 1 given once a day. Patients who are informed in detail as how the supposed medication should work get a larger benefit than those who have a vague understanding of the supposed medication. The placebo effect is important in medical trials, as any perceived benefit of a new drug or procedure will be purely down to the placebo effect. So clinical trials have to be very careful to take this into account. Additionally, fake doctors or those prescribing or dispensing fake medicine could be using the placebo effect to dupe their patients. It should be noted, however, placebos won't be able to shrink tumours or have other similar effects. What placebos can do is reduce pain, anxiety, depression, and other similar medical problems. It's led some medical professions to believe that what's actually happening is driven by the brain, possibly releasing hormones or suppressing activity. Developers of the medication called Naloxone have added new light to this area. Naloxone is often used in overdose cases where it blocks the receptors for opioids like morphine in the central nervous system. However, the effects rarely last for more than an hour. By blocking or obstructing the opioid receptors in the human body, it prevents the opioids or endorphins from accessing the receptors and causing the body to react to them, and then in turn relieving the pain. A really interesting discovery is that when naloxone is given alongside a standard placebo where the patient is informed of the medical benefits of the supposed treatment, the placebo effect fails to function. This means that the patient could be responding to the placebo and the circumstances around it being prescribed by producing endorphins, and it's the release of these chemicals within the human body result in the alleviation of pain or the symptoms of pain and other medical benefits. However, if the patient actually has low expectations of the placebo working or isn't told the benefits of the supposed treatment, then naloxone doesn't actually reduce the effects of this lesser placebo effect. It possibly means that there are actually more than one placebo effect, actually 2 different effects that can be produced. It does leave us with the possibility that rather than the placebo effect being all in the mind, instead it's actually the human body which is actually self-medicating.